My name is Alfredo Rabines. I'm the ED director at Bayonne Medical Center, working with air visits. I've been an ED director now for 3 years. I've worked at 3 institutions prior to this, including NYU Lutheran and Jersey City Medical Center. At Bayonne Medical Center, the amazing thing is we have air visits, otherwise called as CarePoint Connect. It's a service provided by the institution where patients get callback visits, and what they do with that is they use a telemedicine service. They're able to log it on their telephone, and through that telephone conversation with a provider, physician, physician assistant, other providers, they're able to get a session with themselves and this provider after a visit, and they can ask questions about their care. As a physician, that's very, very comforting because it offers a sense of security. You feel like you're sending your patients home, and the teaching and education that you provided them gets followed through. The ER is a very fast-paced environment, so you are constantly moving patients around, and to be able to educate everything you wish you can sometimes becomes very limited with time. So air visits is the follow-up. It's a reassurance as a clinician that you're going to have somebody call your patient and say, did you follow up on that asthma treatment? Did you get that medication for your GI bleed? And that sense of security is amazing. In a sense, you provide patients with direction, get this echocardiogram, make sure you follow up with the cardiologist. The service of air visits truly directs them to get those needs, which is so rewarding for a physician to know that their patient is going to get this. Sustainability is huge when you're implementing a program in a hospital. You need to make sure that you're spending all this money, leadership, process improvement processes to make sure that a program lasts and that everyone's getting used to how it runs so that there's no slipping through the cracks. This year alone, we've implemented air visits since April. It is now, later in the year, we've been on it for just about 12 months. A little on there, but just about there. And the statistics that we have in regards to return on investment has been about 200,000 just on the patients that we've seen from air visits themselves. And overall, the return on investment, tangible return on investment for the institution has been just under $500,000, which if you look at it, completing a program that's sustainable with that return is enormous for an institution. I mean, that money that you're bringing back is going to make an ER at its elite status. So the ER can bring in more revenue to the institution, and you're able to provide services for the physicians that they may need. The Medicaid population is very high at our institution and at many institutions that I've worked at in the past. Air visits treats Medicaid patients as equal as they treat any other insurance patient, just as Blue Cross Blue Shield. And the important thing about that is that we're treating patients equally, and they're getting the same services. Medicaid patients are the ones that get missed. They're the undiagnosed diabetes, they're the hypertensive patients that don't get their medications. They're the ones that are not able to get that specialist appointment. So I think when you launch a program that's providing services for patients, we look at all of them as a whole. It's important, and it's important for patient care. As an ED director, I've had several institutions, programs come my way. Some of them have failed. Air visits has been a sustainable program for me. How do I know that they're well? Because I put them to the ringer. You ask them the right questions, they provide you the right data. They give you metrics to give you the points that are what they're improving on, what they're getting from the patients. They're calling about 3,000 at start, and now they're at 9,000 patients per day that they're calling. That is a significant amount of patients that I can't possibly call in one day. And these patients are all getting laboratory studies, x-rays, CAT scans. They're getting all the needed imaging that they need to take care of themselves. And then we're getting return of investment on statistics they're providing us through metrics. The physicians here use air visits a lot. They refer patients to the air visits. They definitely use the resource because they know that their patients are getting follow-up. Bayonne has a population that we love and we treat on a daily basis. We get family members that come in, of family members. And so what we want to make sure is that our patients, when they go home, they know that CarePoint's taking care of them. So when patients go home, we get a call through air visits, and we know that CarePoint air visits are working in collaboration. What it does is it offers a service where the patients get direction, more education about what's occurred with their visit in the ER. In the ER, the physician, the nurse, they provide some information to the patient. The patient takes home maybe 10% of that in their head because they're in an acute setting. They go home, they follow up with their visits in a more relaxed, controlled setting, and they ask the questions. In air visits, they provide the time. With the data that Air Visits has provided, you could see that it clearly shows that they are reducing 72-hour returns. Patients are more educated. They're more aggressive with their own treatment. They're taking care of themselves.